A recent study found alarming rates of mental health challenges in young adults in California. The California Endowment polled nearly 800 Californians ages 18 to 24 and found over 75% of them reported experiencing anxiety in the last year. More than half reported depression, and 31% experiencing suicidal thoughts. The poll also showed young adults are facing significant barriers to getting help, many saying cost or access stopped them. Dr. Willow Jenkins is with Rady Children's Hospital in San Diego. She says mental health issues for youth were already on an exponential rise before the pandemic.
What happened is the factors related to the pandemic exacerbated the already existing problem. And so the pandemic brought all the stresses of isolation, school disruption, social isolation, impacts on families. But the other piece that came along with the pandemic, which is particularly affecting older adolescents, is the issues related to racial injustice, all the political tensions, and then a lot of emphasis was put on climate change.
Dr. Jenkins says Californians are facing other pressures too.
Being in California is difficult in some ways. Cost of living is high, and a lot of families are struggling to make ends meet. And that means families are maybe working more than one job or working odd hours. And that means they're going to have less time to spend with their children potentially. And so that's going to have that effect on children and families.
The increase in mental health concerns is pushing some schools to be proactive. The Escondido Union High School District has been offering high school students mental health support since March, but a new mobile resource is allowing them to expand behavioral support.
So there are a lot of visible and invisible barriers that prevent people from getting service. So one of the things we want to do with this clinic is to be able to improve health equity for them. We need to bring services to them to reduce those access barriers like transportation, finances, being able to take time off work when parents are very busy schedules and get to work.
Wendy Vieira is with Neighborhood Healthcare, the provider giving the care.
Everything is escalated. We have kids with a lot of trauma, a lot of abuse, bullying, things going on, tremendous anxiety and depression.
Vieira says the mobile health center will spend one day at each of the Escondido high schools every week. It will start with counseling services and eventually expand to dental and psychiatric care. Kim Bodie is the Escondido Union High School District social worker.
We're trying to create spaces of wellness and the ability for students to self-refer for counseling.
She says there has been an increase in students reaching out for help.
We think this is a good sign as mental health literacy seems to be improving with our young people. There's been so much campaigning and notice around social emotional well-being.
She hopes talking more about mental health and offering resources will lead to more students getting the help they need. Tania Thorne, KPBS News.